I'm Jayachandra, Senior Interventional Pulmonologist working in Care Banjara Hospital and been in this field for over 30 years or so. Now, I've been asked about stages of lung cancer. Now, lung cancer is not a single disease. You have different kinds of cancers. But for the lay public, the first thing that you need to know is there are two broad categories that we normally work on. One is what is called as a small cell carcinoma, and the other thing is called non-small cell carcinoma. Both these things are cancer, both of them are equally dangerous. And in small cell cancer, it's a very aggressive type of cancer. So we categorize it into two very simple kind of stages. One is limited disease, second thing is extensive disease. That's all there is to it. There are only two stages in small cell carcinoma. Limited, extensive. Both ways, this is a nasty disease to have, it's a bad disease to have, and the life expectancy is usually much smaller than what you would expect in other kinds of cancer. And this predominantly is seen in people who have smoked for a long time. Now let's talk about the other variety, that is the non-small cell lung cancer. Now here we have different stages. You have stage 1, 2, 3, 4. We usually categorize it into different things to make it easier for us to understand the stage of the disease, which when we talk about stage 1, okay, if I say stage 1 lung cancer, the oncologist will understand exactly how much of a disease has spread, where it is, or it is localized, and that he can go in for one particular type of treatment. Whereas stage 4, he knows, even without my mentioning it in so many words, that it is spread all over the body and probably the treatment is not going to be as effective as it is for stage 1. So that is the reason we tend to put them into different categories like 1, 2, 3, 4. So that we know, okay, stage 1 will require this kind of treatment, stage 2 will require this kind of treatment, stage 3 is, maybe surgery is not an option, maybe chemotherapy, and then probably, you downgrade them to stage 2 and then we decide whether to go in for surgery or not. So this is how we normally go about it. And for convenience of understanding between doctors, normally we have what is called as a Tnm classification. This is again looking at it like this. T is tumor. So you have different sizes of tumor. Depending on the size of the tumor, you categorize into T1, 2, 3, and so on and so forth. So the moment I say that, if I say T3, people know that I am talking about a tumor size between 5 to 7 centimeters or so. So it makes it easier for us to understand this. Then you say, okay, N1, N2, okay. Now what does it mean? That means the tumor has spread to the local lymph nodes. That is N1. And if it spreads a little beyond, then say N2. If it is spread to the opposite side, you say N3. Alright. And then what is this M? M is metastasis, that is how far it has spread. All over the body, if it is spread, yes, it is metastasis all over. So if you say T1, N0, M0, that means we are dealing with a very early stage, that is stage 1. To go into the actual staging in all its detail, this thing is probably too much for the lay people to understand. So let's not go there. It is enough for you to understand that T1 and T2, stage 1 and stage 2 are early phases of the cancer where the prognosis, that is the treatment and the results as are dictated by the treatment of these two stages, is going to be much better than stage 3 and stage 4. This stands to logic. So that is where we stand. So you would prefer to get you prefer not to get the disease at all, but in case you get it, you prefer that the disease is picked up early, wherein in stage 1 or probably stage 2, alright, so that they can be properly and adequately treated so that you have a very good life expectancy in spite of the disease being there but getting treated adequately. When you come to stage 3 and stage 4, that means where you have neglected, you have gone on, no, it's all right, I'll wait for another 3-4 months before I go to a doctor. By the time you've gone to stage 3 and probably stage 4, the results are not so good. Of course, these are much better than what it used to be 10-15 years back. But still, it means that, the chances of a complete cure at stage 4 are not as good as for stage 1 and stage 2. So that is why it becomes very important that we recognize this disease very, very early, and the role of the specialist always is there, and you need to visit a specialist at the slightest abnormality picked up on a chest x-ray, particularly if you're on the wrong side of 50, probably if you've been smoking in the past. You may say, oh doc, I've given up smoking 15 years back. Doesn't matter. If you've been a smoker, you still stand a very high risk of getting cancer. Even after quitting 20 years down the line, you are still at a higher risk of getting lung cancer than otherwise. A non-smoker's level of risk can never be achieved in an ex-smoker. Let us put it very, very clearly. Thank you.